Hello and welcome. This is Deepak Mishra, and in this video, we are going to talk about interview preparation for doctors who apply to Germany. Now, this interview preparation will be for the job, not for hospitation, any other thing, for the job. Now, this video I have created with the thought of summarizing my experience of around 23, 24 interviews that I have taken in Germany and work that I have done in four different hospitals in Germany. Okay. I came to Germany in October of 2014, and within 2 months' time, within the 60 days, I already had my first job, like Einstellungszusage, that promissory letter. Now, for this one job, I had to send lots of emails. Obviously, I say that always to my candidates from consulting program that okay, you have to, as soon as you plan to move to Germany, as in travel plans are made a couple of weeks before that, you have to start sending intensively emails to different hospitals for jobs. Because I also did the followed the same process and did that. So I had around 10 interviews lined up. From those 10 interviews, around 6 interviews were successful. That was for the first job. And after that, I took many interviews and I have changed three hospitals, three more hospitals. So I have worked totally in four hospitals in Germany. My last change was in 2019 when I moved to Essen in Germany. All right. Now, when you go for an interview, if you go for an interview, it's half done already. It's 50% chance that you're going to get selected. So that is definitely a positive sign that you have been called for an interview. Okay. Now that means all the papers that they have seen, that is matching, like whatever they need, the experience that they need and everything that is there in your Anschreiben, first of all, that motivational letter that you have written. So that was good, so that caught the attention of the person reading it. That is one point. And second point is that the CV is either good or there are no red flags in the CV. Okay, so these two criteria match, and that matches to the requirement of that hospital, of the department at that point of time. So then they will call you for the, and they don't have better candidates, or they are calling all candidates to see how whom they can choose. Okay, so there are different permutations and combinations available or possible. So they will once you invited, it's certainly one step ahead. 50% you can be sure that you will get that position. Now the rest 50% depends upon your answers and your likability. If they like you, if they like your personality, if they like your answers, if you can communicate with them in proper German, because that is the most important factor, that communication. Are you understanding everything that they're saying? Are they understanding everything that you are saying? Okay. In some hospitals, they also offer you a hospitation, 1 day hospitation, that you will come in the morning, this entire day you will stay with the team, doing different things or not doing anything, but seeing everyone, accompanying people. And you'll have a half an hour interview, or maybe 1 hour, not 1 hour, 1 hour is too much, half an hour interview with the boss at the end of the session, like at the end of the day. And then he will tell you how did he like you, not like you, or like how he thinks about it, what the further plan is. So the different modalities of interview and hospitation combinations and all. So what you have to, from your side, the preparation, what it has to be, first of all, if you are already in Germany and you have received an appointment for interview, mostly it is in the afternoon time. I recommend you proactively tell them that you want to do a hospitation. Okay, so if your appointment is say 2 o'clock in the afternoon or 3 o'clock in the afternoon, you tell them that I would like to come early in the morning so that I can have a little bit look in the clinic and meet the team also. That creates a positive impression that this person is really inclined to work with us. Okay, he wants to really see the team and is not hesitant, is not shy, and does not want to hide things, because if you are seeing them, they're also seeing you for the entire day, right? So that is one thing that I always emphasize that you should do. I did that in my time when I was doing it, and I find it's a good way for you also to get an idea. Because if you go only half an hour and you just see the hospital, it's somewhere in the jungle somewhere, and you met the boss and you understood half things, how you did not understand half things, you don't know how the team is, are there any Ausländer, any foreigners in the team, or is only totally native speaker team, how the entire atmosphere in the department. If you don't get that, then you are also not sure that if you will be matching in that team. Because even if you go to some unsuitable place, they might take you at the time because they need manpower, they need people. but you don't feel comfortable over there. And in 2 weeks' time or 4 weeks' time, they don't feel comfortable with you. So then it does not match. And if you take such a position in the beginning, I always say, take in the beginning, take whatever you get. Okay, later on you can choose and like go for better places and better departments and better hospitals. That is true. But you have to understand, in the beginning phase, if you go to one place and spend 2 months time over there, you have to move, you have to take your things, you have to do Anmeldung, everything costs money. And then again in 2 months, you have to choose some other place. So in this time, meantime, you have also taken a break from application sending because you are in a new hospital, you are working already. So that is why I'm saying that if it's a matter of even in the process, be little bit sure. Just don't go blindly to any place. Okay, take some idea at least that okay how is the place, how is the team. Talk to different people in the team. So this hospitation, that 1 day hospitation, helps you give an idea, okay, about the situation over there. So I recommend that even if you have only interview, still ask for a hospitation, 1 day hospitation at least. That can I come and have a look at your hospital doing a 1 day hospitation. That, and I don't think anybody will deny that. Why would they do that, right? So that is one thing. Now when you go for that interview, what they want to see is that uh, they already have your CV, but they want to know details of what is in the CV. So they will ask you about, tell us about yourself, or what is your career projection so far. So you have to just be in short. You have to explain yourself. Who are you and how old are you? From which part do you come? From where do you come? Where have you done your, like where you have done your graduation from? And in short, not because CV is already there. They just want to hear in short. What they want to know in detail is your professional experience, if there is any professional experience. If there is no professional experience before that, then you can say that okay, you are a fresher and you have did not have the chance to work anywhere in your home country, because you wanted to come to Germany as soon as possible. That's why you have spent time learning the language, learning the system about Germany, preparing for the Fachsprachprüfung, and all these itself takes 1 and 1.5 years time. So that also a reason is valid. You have to just be convincingly, you have to explain that okay, I did not want to like defocus from learning the language because that itself is hard. That's why I did not work anywhere and I focused on one target. So yeah, that is it. So that is about your professional CV. They will ask. Then they will ask you. They might ask you about if you want to go back to India or to your home country. There you can answer diplomatically because that is too far away. The Weiterbildung time itself takes 6 years. Okay, and after that you will need one to couple of years more experience, maybe some fellowship. So you have to just ignore, not ignore, but postpone that question. That okay, it's too soon. I have just come here. How do I know? I mean, I'm not planning to go back as of yet. Um, but if situations arise, then I will see about it. But right now, my focus is Weiterbildung. My focus is training. That is what you should say. You have to always maintain that you are not someone who is just looking for a job to get a monthly salary and live a relaxed life. You're not looking for that. You're looking for training. That is what you have to maintain all the time. That is because if they cannot offer you good training, because there are also hospitals in Germany where the training is only namesake. They just want people to do work, and the training is their own responsibility. So there are also so you have to be careful of such hospitals also. Then that means that if you say during the interview itself that okay, I'm training inclined person, then they might think that you're not suitable for them because they know that in their hospital there is no training. So and that way you are also saved from going to that place and then regretting it why you took that position. Instead of that, you could have waited a couple of months more and taken a different hospital, a different position. All right, but this thing is very subjective. There's no way to find that if this is a good training hospital, not training hospital. This you can find only from people who are working over there, and that way, that is what I meant in the hospitation. When you go for 1 day hospitation, you meet the team, you can talk to them, what do they do, how the daily work is, if in surgical branches, if somebody's in third year, what they have operated, if somebody's in sixth year, what they have operated, and how the workload is, and all those things that you can talk about in the in the 1 day hospitation. Now, about the interview further, they want to know about your hobbies, your future plans. Like, are you more research oriented? Are you more do you want to go into private practice in the future? So that time I would say you have to be diplomatic and you have to answer like the place there you are. Like if you're applying for a praxis, for a private practice, obviously then you will say that okay, your plan is to go future in a private practice. When you are in a university hospital sitting in front of the professors over there, then you will say that you are research oriented and you are looking for academic career at a university level. So you're not interested in just like going home at 4 o'clock and a relaxed life of the private practice. So if you're in a smaller hospital, there where no research is done, only patient care is done. There you have to maintain like that. That okay, look, I'm not some research-oriented guy who wants to sit and write papers and get research published. I want to be involved in patient care. I'm a doer and not a planner and thinker. I'm a doer. I want to do. I want to learn surgeries. I want to treat patients. I'm a clinician and not a researcher. So you have to have your ideas clear in your head also, and depending upon where you are sitting, you have to answer accordingly. Now this you can be of that opinion that okay, I am one person, how can I have different answers at different places? You can be yourself and answer where whatever you like, and then you will be chosen at the place which suits finds you suitable for them. Okay, but then the search will be long in that way. All right, so this is about the interview. Now, subject matter. Now, when I used to take my interviews or give interviews later on, I always, in the initial phase, when I went for a gastroenterology interview, for example, I tried to cover up lots of gastroenterology, like from some book in last week before the interview, so that to have some idea. It's a good strategy, okay? Uh, because in my case, I did not have any work experience. I mean, I had work experience, but not a clinical work experience. I had worked in ICU. Clinical means not the what you say the interviews that I was giving here. I have worked in ICUs. I have worked as a Zilla Parishad medical officer. So I had worked those jobs, but it was not like that they do in Germany. So knowledge-wise, I had some knowledge because I had studied for USMLE. So knowledge was there, but clinical experience was not there in my case. So to even though I had knowledge, I have studied before the interview so that I could convert things in German and say that in a fluent way as if I know what I'm talking about, because they can find out if you know what you're talking about. So many times I moved from German to English during the interview, and that was also fine. That was also when it came to subject matter. I remember one interview in gastroenterology where it was we're talking about diabetes and how the pancreas works and the islets of Langerhans and all the. Now I even forgot those how those things do work, but that time I knew that, and I was not able to explain that in German. So I switched to English, and that was fine with the doctor over there, and he offered me the job later on over there. So you have to prepare a little bit about your FAQ competence. That means the subject matter where you want to apply or where you're going to apply. Also, what they will say that if you are an orthopedic surgeon, okay, and you have worked, so they will ask you not directly your knowledge, but they will ask you that okay, what kind of cases did you see? Or even if you're assistant arts, a resident, a medical officer, say I worked in emergency, I worked in casualty in some hospital in India, for example, they'll ask you, okay, fine, then what cases did you see in your casualty? You'll say, okay, I saw MI patients. Then they'll say, okay, though, what were the symptoms of those typical symptoms of MI patients? How did you diagnose that it's MI? And how did you treat it? What was the protocol? Which standards did you follow? Which medicines did you give? So they will ask you about the cases that you have seen. They will get it from you that what cases you have seen. And once you say I have seen this case, then they'll ask you, okay, tell us what was this case about. And so that way they get an idea at how academically sound you are. Okay, so that is one way to find how academically sound you are, because cases are same everywhere, almost same everywhere. Okay, so yeah, this is about the fachlich, the knowledge base, and then they want to see how communication I already told, and then they want to see that what is your plan. If you're more research oriented and you're just looking for a short term temporary first place anywhere, then if you're right person for them, that is also to be like they will have to consider that. Or if you're long term person, if you're a family oriented person, if you're married, if you have children, because if you're married and have children, then you want to settle at some place, then you will settle there, you will get your family from your native place on family reunion. So for them, then you are a stable member, stable employee. For somebody who is like very young and very dynamic and very can move, pack his bag and go any week. So for them, that candidate is little one side. That candidate is very energetic and hardworking. Okay, but other side is that they might lose that candidate anytime. So that consideration also comes into play for from their side, from the employer's side. Okay, so these are the basic things that comes in top of my head about interview, about when you prepare for interview. These things you have to keep in mind. The atmosphere is mostly very chill. Sometimes it is very what you say, not so chill. It's very penetrating, I would say. I had one such experience where I went. It was I knew that beforehand because I have read I've talked to people about that person, about that interview. He's a very big shot professor, internationally known. When we see any books in orthopedics and trauma or anything, his name is always there in some articles, big articles. So now he's retired, but I had the opportunity to meet that person for 20 minutes, and in that 20 minutes I got to know how uncomfortable it could be an interview. And that person did not talk to me much. Okay, I was sitting, and there were three people for that interview, two Germans and one me. uh, One German was from the same city, and he has studied also at same place, and one was the own candidate who has gone there. Like after Fakat's 1 year, he has been somewhere, and then he came back and he applied again for the Fakat's position. Now I was in the fourth year that time, like third, end of third year, I think that time. So I was very, in comparison to those people, I was very young, and also I was a foreigner, and also I was not known to this place. I came from a different city, and those were the in house. So as soon as I saw those people, I realized that okay, it's not going to work for me. But still, will get the chance to meet this person, and I will have an opportunity to do hospitation over here one day. So I took that very positively. Let me see how it works, and let us. So I did entire day hospitation in spine surgery over there. Saw different the X-rays that I saw over there from spine operations I had never seen in my life before. The types of operation that they had done over there, and so that happened. And when after that there was an interview, and in that interview there was Oberarzt who was sitting over there, and he had a list of questions, and one after another he asked me questions, and the answers that I gave, he was tick marking some things. He was like writing something or some points. I don't know. He had a tally of all the candidates. They're giving marks or something. I don't know. And the head of the department who was sitting, he was entire 20 minutes or 25 minutes that interview was, he was penetratingly looking at me like this, like every answer. And as soon as I looked at him, I could not answer anymore because I was very conscious. So these kind of interviews I've also seen. That did not work well. I knew that beforehand, that okay, that was not the place for me to be, um, because of the atmosphere and because of the expectations that was expected over there. And but there are also other interviews where I went for an interview. That was in 2019, before I took my last job. I went for the interview, and that person, there were two head of the departments over there, and we started general interview, as I already mentioned in this video, all those things. And then later on came topic of hobbies. Then I said that I used to do martial arts in my school days, and then there was one person was a martial arts fan. So then the conversation went on martial arts, that which school of martial arts, and this and that, and all those things. And do you practice now, and why did you leave it? When I said that okay, I don't do it anymore, then why did you leave it? Then I had to explain how it was difficult to maintain a hobby in Germany alone, without any what you say companions who would be interested in that. And that was very, it went very informal way. And then they asked me about more hobbies. What do you do? And then I said, I mentioned like I do YouTube videos, and then they wanted to see my channel. Then they saw the channel, they saw a few videos, so the interview. Then they went on the website, they see how the consultancy website is there. Then I must be, they saw that 2 million subscribers are there, then I must be famous among Indian doctors coming to Germany. I said yes. I told them incidents about how people I have met like people on Hamburg airport and the Bremen train station, and how people recognized me on those stations. And so the interview, after all that interview, I thought that this has gone totally in the different direction, and this is not going to work out. Nobody would want to have an assistant arts of this profile basically. Okay, this all shows that how you spend your time doing other things other than surgery. So that was my thought, my opinion. And but what happened is that 1 week later, I got the call that okay, can you come for 1 day hospitation? So by that time, I have already decided for another hospitation, a hospital. Like I have already decided, okay, I will take the other hospital where I'm working now, and it was also a better decision for me in many ways. So then I politely declined that. Okay, sorry, I already took the position at other place. So that interview, which was one was so penetrating interview where one person was so sitting and conscious, making you conscious all the time, and you could not answer anything, like you did not know what to say, what is the right answer to this question. And other place was so jovial that two shepherds, they were like they're talking like friends to you. Okay, so that is also not a very good thing to do. I mean, in my view, you have to keep that hierarchy, you have to keep that level, a difference of levels. But that was like that, and that also, in my view, the reason why I did not, they asked me for hospitation like before, I did not confirm that or did not approach them for hospitation, is that I did not want to work at that place which was so unsystematic and without hierarchy, without difference of without standards. So people, now I should not say without standard, that's the wrong word to use, because those were very proficient surgeons and very famous surgeons, and it would be great, but it made that penetrating into the things that I did not want to reveal in a professional interview, that I found little offensive. I found it like they are trying to indulge or invade in the things that I don't want to share in a professional interview. I make videos for public, in public domain. That is correct. Everybody has access to that. At present, my boss knows that I make videos, and the entire staff knows I make YouTube videos and I have a website and everything. They know that, but they don't talk to me much about that, and that I find fine. That okay, we work, we do things at our own standards and our things. I do hospital things at hospital, my other things at home. So nobody should be much bothered about that. But that extra interest, I found that if I worked over there, there they would start penetrating more into things that is not relevant for them, according to me. That's why that was also one negative thing that I like in my view. That's why I did not pursue that further, and by the time I also had another job. All right, so this was about my short, not it's not short, it's quite long video now. It was totally unscripted. I have just spoken what I felt like, and I would really appreciate your thoughts and views, what you think on this channel, on this video, and I would appreciate if you subscribe to this channel and share this video with your friends and colleagues.